Hi, this is Jonathan Damonte for Bowen-Online, and this video demonstrating the baby Bowen procedure is going to follow this description of the protocol and the procedure itself. But starting out, I'd like to make note of the many uses of Bowen therapy in pregnancy and childbirth, and of course treating newborns. So you could use Bowen therapy for a multitude of the symptoms that manifest during pregnancy and especially following, from the wrist pain and the back and sacral and pelvic misalignment that is so common during and after pregnancy, and even the symptomatic relief of nausea and heartburn and such. So very, very useful. This protocol is the main protocol we use to treat colicky babies, and it's not the only one, but it's the one we can safely use and teach our clients. So this video may help that process and give them the information necessary to be able to do it at home for their children. So pay attention to the details. It's not easy to learn, but once you've got the gist of it, it's very, very simple. So the preamble will explain the hows and whys, and then the demonstration will make more sense when you see it towards the end of the video. So very briefly, to describe the position and the type of moves that we make, we're doing two pairs of moves on the back of the child between the spine and the scapula, two inward and two outward, and they're over the same spot. On the front of the baby, or toddler in this case, we're going to find a holding point just below the sternum and the cartilage called the xiphoid process, and that becomes a holding point placed very softly on the tummy of the baby. At the same time as holding that, we're going to do move 3 and 4, which is either with a thumb, a flat thumb, or finger, and then finally we remove the holding point and do a downward move for move 5. We want the baby to be relaxed and not applying tension, so wait for their breathing to exhale, and then you can apply your pressure or your moves. So to understand the procedure for baby Bowen, we should look first at the related procedure for adults, and here we see the first two moves of the normal respiratory procedure. So it's a lot more elaborate, whereby we're positioning the client or patient in a specific curve of the back by having them turn their head and rotating their hip to facilitate a curvature of the spine, and we do these moves over the erector spinae in a specific position. So that's moves 1 and 2. We'll now look at the moves done on the front. So we would first position our holding point 3A, which is the same as we would do on an infant. We're going to feel along the sternum until we reach the xiphoid, which is cartilage just below it. And without pressing hard, we want to go below that, a good finger or finger and a half below that, to a very soft spot on the top of the tummy, or top of the abdomen itself. And we're just going to sink our fingertip onto that with just the same amount of pressure you would use to rub your eye. So very comfortable, but you are applying some pressure. While holding that, we perform the moves 3 and 4. Now, these are located under the ribs, or below the ribs, I should say, and they are going over the rectus abdominis muscles. So we do need to sink a little bit down onto the abdomen and the abdominal muscles, rectus abdominis. Here you can see the on the back, of course, moves 1 and 2, showing just move 2 there, but on the front you can see how the moves 3 and 4 go over the edge of rectus abdominis, and that they are below the rib cage. And the final move, move 5, is performed by removing your holding point and then taking a little skin towards the holding point from below it, pressing down, and then moving towards the feet. So this is just to show the positioning of the moves 1 and 2 on the back. And this is the same for the infants. We want to find the lowest edge or inferior angle of the scapula, and we're going to mark a point midway between the inferior angle and the medial border of the scapula and the spine, and that's our starting position to do moves 1 and 2. We then take skin slack toward the spine, apply gentle pressure, and move laterally away from the spine, just like the arrow shows. So when we work on the infant, we're going to see the same thing, but we'll be doing it with one finger only. Yeah. Remember, when we do the baby Bowen moves, we do a medial move first, and then a pair of lateral moves following. So just briefly to show the anatomy of the abdomen and the rib cage where we're going to be doing the moves. So on the left side you can see the xiphoid process. It's a really a tip of cartilage. We want to be below that, and you can almost see the nerve where we're going to apply the holding point to. So this is done with very gentle pressure. The moves 3 and 4 are performed over the rectus abdominis muscles, and we want to feel the edge of those muscles. So it takes a bit of practice to be able to be deep enough, gentle enough, and secure enough on those muscles to be able to move over them. And with Bowen moves, we're moving the skin over the muscles, so having a bit of skin slack is very important. Great, so looking at the protocol in precise detail, you'll have this handout with this description on it. And you know, holding the baby with the mum or dad holding them so you can work on them is perfectly acceptable. Take your time, make the moves count. You'll see in the video that you know, I just applied the moves without any thought to getting it perfect or not. That's not the goal here. It's generally to help the area of concern relax, and that's what these moves do effectively so well. So step 1 rather is to work on the back, doing moves 1 and 2 medially, followed by another pair laterally. Turn the baby over for step 2 and do the 3 moves while holding the holding point 3A. So we're going to perform move 3 by landmarking the position over the rectus abdominis just below the rib cage, and then performing the same thing on the other side, the right side, for move 4. We let go of the holding point, take a little skin up to the holding point from below it, press down and gently move the skin over the top of the tummy area. That move is very small and has the most impact, I think. So now we're going to watch the video. Hope you can relate to it. This is Arabella. She's going to be our model for today. And to do the first 4 moves, I'm going to roll Arabella over. Here we go, love. There we go. So she gets a bit of tummy time too. So around about where you do moves 1 and 2 of BRM2, you're going to landmark the scapula and then the erector spinae just adjacent to either side of the spine. So working on the left side first, we do a normal Bowen move medially, on both sides. And then we're going to do the parts 1 and 2 of the respiratory procedure using the same finger on the same side with no pauses. Arabella's 2 months old and very much ready to start lifting and rolling over. So we're going to do move 1 and move 2. 2 pairs of lateral moves. We'll roll Arabella over once more. Big stretch at the same time. There we go. And on her tummy, we're going to make our holding point. Just like this. And she probably won't like this too much because it's a bit pokey. So use a soft, gentle finger. And then using your thumb, you can take move 3, move 4, under the bottom of the rib, sink down, nice relaxed tummy, move 4, and then finally move 5. So wait for a nice breath in and out. And then on a relaxed tummy, we do an inferior move, like so. That didn't really catch the right tension, so I'm going to repeat. And she's so wiggly and squiggly. She just woke up. And 5. We'll leave it like that. I won't do more than twice. But you can even see the landmarks on the fingerprints. So 3A, 3, 4, and 5. And as you can tell, she's quite happy. Aren't you, Arabella? You happy? Mm-hmm. It's going to make you digest very well, isn't it? Yeah. Okay. So just to recap, we perform 4 moves, 2 medial and 2 lateral on the back using our finger. I use my middle finger and just very gently sliding the skin away from the muscle and then moving over the muscle. We turn the baby over and we perform the moves 3, 4, and 5 while holding the holding point for moves 3 and 4 and just letting go while we make move 5. Remember, this can be repeated if it's helpful, and you may not see the immediate relief, but give it a few minutes and you might see a change, and that's what you're really looking for. It's just a gentle change in the state of the baby. So for many mums and dads, this can be a fantastic tool. Thank you for watching.